Myeloproliferative neoplasms, as everyone is aware of, are associated with significant cardiovascular disease. I think the most common things that we think about when we think about cardiovascular disease and myeloproliferative neoplasms tends to be thrombotic events such as arterial thrombosis, myocardial infarction, venous thromboembolism. However, there's been a lot of animal studies looking at JAK2 mutated mice that show that in those mice there's adverse cardiac remodeling that's accelerated in JAK2 mutation compared to mice that are not, and so I think there's a lot of possibility that patients with myeloproliferative neoplasms are increased risk of heart failure, particularly among those patients with myelofibrosis. So myelofibrosis is the advanced form of the myeloproliferative neoplasms, can either be primary or secondary to the other types. And associated with reduced lifespan, but also significant risk of pulmonary hypertension and splenomegaly, things that affect the cardiovascular system. And so I think a lot of the cardiovascular disease and risk factors in patients with myelofibrosis tend to be overlooked. So in our study, we looked at patients, again, hospitalized for heart failure with myeloproliferative neoplasms. And what we found was that myelofibrosis was associated with increased risk of cardiovascular readmissions. And what's interesting, is there was an increased risk of thrombotic readmissions where, one generally doesn't think of myelofibrosis as being a risk factor for thrombosis, given that thrombocytopenia can be found in those patients. But that this study and others have suggested that there's an increased thrombotic phenotype in these patients as well.